Hi, I'm Dr. Muralidhar Joshi. I'm Director of Virinchi Pain Management Center at Hyderabad, that's Telangana, India. Today I would like to share some of my thoughts about the new challenge that is going to happen in India, which is going to be a big problem in coming years, and that is going to be the pain management. The simple reason for that one is just look at how our country has evolved over last maybe 60 to 70 years from the time we got the independence. When we got our independence, that's in 1947, our average population lifespan was about around 32 to 35 years. That one went on up to 47 years by the year 1960s or 1970s. It went up to 54 years by 1990. Now currently when we're sitting in 2016, or sorry I should say now 2017, because we're recording in sometime in January, the average lifespan for women in India is 69.5 years and for men it is 67 years. Now if you might be wondering, how does it matter for us? Yes, it does matter a lot. See, when we got independence, the biggest problem, health problem, what was troubling us was hunger, malnutrition. And that was the reason why people were dying. And probably people who witnessed the pictures of Second World War, they can definitely understand how significant was it that people were dying at the age of 32 years. And come 1960s, by then we could overcome the hunger, to certain extent malnutrition, but still people were dying because of the reason of infectious disease. From that also we could do a lot of work with Green Revolution and with all the kind of medical management and all those things. Many of the chronic illnesses like smallpox and other things, we could take them out. So people started living for longer time. Come 1990s, people started developing so-called diabetes and hypertension, but the infectious disease things were getting settled. The infectious disease problems were getting settled and infection was getting controlled. And slowly by 1990, the lifestyle diseases started hitting India very bad. Something like diabetes, hypertension or ischemic heart disease. And subsequently somewhere the cancer started creeping in. And you might be wondering, how are these things related to pain management? Yes. If you just look at about 1947, we never talked of so-called insurance and all those things of what we saw in 1974, like the government slogan saying that hum do, hamare do. That time the whole idea was population control. From there it went up to pehla bacha abhi nahi, dusra bacha baad mein. That again population strategy. From there slowly we moved on. Now if you just look at the slogans being released by the insurance companies, the insurance was never an issue till 1980s and all, because people never lived for longer time to claim insurance. Now people are living about 65, 70 years very easily. Now we talk of what we call Alesi Policies, saying that Jeevan ke saath bhi, Jeevan ke baad bhi. That means everything is evolving as per the need of the hour. If you just look at the prevalence of the common health style illnesses you are seeing these days, the cancer prevalence across the globe might be around 0.4%. Maybe hypertension might be around 6% and diabetes might be 7%. But you just look at the end point of cancer. The people are not scared of death because of cancer. People are scared of death because of painful death, which is secondary to cancer. They're not scared of death, right? But look at the amount of investment that has gone through in relieving the so-called the cancer problem. You talk of surgical option, we talk of robotic surgery, you talk of chemotherapy, state-of-the-art medications, you talk of radiation oncology and other things, you talk of linear accelerator, pinpoint, cyber knife and all those things we talk of. You talk of our surgery, you come back from cancer towards, I should say, diabetes. The end point of diabetes, let me remind you, we are in 2016, not 2017, sorry, I had correct myself again and again. 2017, just look at it, it's just about 9 years from now. India is going to be the sweetest country in the world. The reason being, 25% of our population will be diabetic. Once you're going to have diabetes of about 6 to 8 years, you are going to get some kind of neuropathy, nephropathy, angiopathy, retinopathy, so on and so forth. So, By 2025, we'll be the sweetest country in the world with this kind of picture, and we have to handle the end point of diabetes, that is neuropathic pain. Yes, I talk hypertension, that again is a cardiovascular disease and leads to all kinds of atherosclerotic other problems. Again, the end point is peripheral vascular disease. That means the end point of all these so-called lifestyle diseases, what we talk of cancer or diabetes or hypertension, it ends up in pain. And we talked already about cancer is 0.4% and maybe hypertension of 6%, about diabetes 7%. The prevalence of pain across the world is anywhere between 22 to 26%. And you might be wondering, okay, that's a big number. That means at any given point of time, one out of 4 or 1 out of 5% is in some kind of pain at any given point of time. In that case, we have to understand that it's definitely going to be a bigger problem, because as the government of India release the statistics and all, the lifespan is going to increase across both male and female at the rate of about 3 months every year from now onwards. That means the longer you are going to live on this earth, you need to pay tax to the government, or for that matter, probably the nature. In that case, you just look at it, it's going to be a big problem. The problem here is no new molecule has come in pain management for pain relief in last 15 years. And if you ask me, sitting in 2017 January, there is no new research going on with respect to analgesics. That means even if I start research today of discovering a pain, or probably trying to do research on analgesic medication, it will take me 15 years to come back into the mainstream of the population. In that case, the biggest problem that's going to happen here is next 15 years we may not get a new analgesic. That is quite detrimental for us. Whatever we have right now, opioids, we have the fear of so-called addiction liability if used for longer time, especially the stronger opioids, not weaker opioids. Talk of NSAIDs or enzymes is not to be used more than 10 to 14 days. We don't have much options. Here the challenge comes, if someone has osteoarthritis knee for such a long time, how do we tackle this group of patients? The common clinical conditions, what we are going to see in day-to-day life, in the, I should say, or probably common clinical conditions you are going to see in day-to-day clinical practice, you should understand is the backache, the headache, or probably for that matter, osteoarthritis of the knee, shoulder pain, so on and so forth. And here we are talking about what is called as especially for the undergraduate students, that they should be posted in periphery for 1 year as part of rural posting. That's fine from government thinking. But look at this kind of profile which is being there. What do we expect this young generation to handle, or the young doctors to handle in periphery? The young doctors can only handle over there probably infectious conditions like probably malaria or maybe tuberculosis, or for the diarrheal disease or respiratory tract infections. Apart from that, they cannot do surgery. Let's understand, they cannot do surgery, but definitely they are going to handle the pain conditions. So we need to have a kind of a curriculum to teach the students at the undergraduate level, postgraduate level, how to handle this pain condition, because it appears as if end point of all these kind of illnesses or degenerative diseases seems to be pain. That includes degenerative spine disorders also. And we don't have new molecules. In that case, then how do we go from here? This is the biggest challenge what we are going to face. So in this context, the Virinchi Pain Management Center would like to highlight the innovative things what is being planned from this particular platform at Hyderabad. We do train doctors, young doctors, in how to tackle the pain, the principles of pain management, how to go about it, and we have a vast network with respect to not just the question of national pain societies, but also the international pain societies like World Federation of Society of Anesthesiologists and also International Association Study of Pain. We are working constantly on training the students on the state-of-the-art mannequins, which are probably one of its kind in Asia, which we got it imported very recently, and where the students are being taught how to handle these painful conditions. So that is one thing what I would like to say. Apart from this, we do run the training program for 1 year program for training the students and the doctors and all who come across the globe for getting trained here. But having come to the gadgets or the tools or probably the medications which are available, we are doing all the pain management techniques or for that matter medication administration or the treatment as per the international guidelines, which is very much evidence based. The medication that is required, the interventions that need to be done, that includes the counseling, CBT, talk of the rehabilitation program, and all this, so on and so forth. Along with that one, if you talk about interventions, we do what is called radio frequency ablation, we do what is called ultrasonic nerve blocks and fluoroscopic guided interventions. We are here to do all the spinal cord stimulator implants, the intrathecal opioid drugs implants, and all those things. We are here to deliver all these things. But only thing is, what we have to understand is, does the patient need all these things? We have to take a kind of a compassionate healthcare where it's important we have to establish whether patient will get the good relief or not. It's not that we can do all these things. No, it's not the way it should be done. Because we are going to have tomorrow probably cyber knife over here, robotic surgery, all those things being planned. But having said all those things, one thing that remains is the human touch. For any of these medication, any treatment, human touch and the logic and the logistics that need to be worked out. The idea is to think globally, act locally, and probably for all many of these local problems, there could be global solutions. We have set up an exchange program in this regard. But apart from this, if you ask me, we have the state-of-the-art operating rooms and the state-of-the-art the post-cancer care recovery units, and we work as a department. I have my own other colleagues and all. But one thing that gives me satisfaction is the greatest relief one can offer to mankind is a pain relief that we are doing to the best of our knowledge and capacity. We thank Virinchi for providing all the platform, and we also thank the Doctors Time team for taking that extra time to record our views about what exactly is pain management and how it is going to shape our country's future. Because unless you are going to have a healthy adult or healthy student or healthy soldier who is pain free, you will not be able to conquer. And pain doesn't have to be, I should say, only the nociceptive kind of pain, like where you have to take medications. There are some pains which are unexplainable, where we need to play a role. Something like a social kind of problem. Probably a patient with cancer comes and all. The cancer patient who has cancer has its own different kind of pain, but the family goes through a lot of psychological stress. They also need to be counseled. There are times we do get probably elderly couple within Hyderabad who come and walk into us. They say their one son is in Australia, other daughter is in America, and but they are both of them are staying alone on 34th floor in one of the building, but there's nobody to escort them to take to the doctor to attend their basic needs of osteoarthritis knee. Now, how do you tackle these kind of social problems? That's a different kind of pain which we should understand. That is not a question of analgesics and medication. It's a question of missing the near ones and dear ones. That is the main thing here, which we need to address, we need to counsel, we need to make them realize, maybe wherever it's required, appropriate, and we can counsel the family members how best they can go about it. That is how the pain man doesn't have to be only medications. This kind of role. There are times I do get people with some social other problem, like in a working couple, they come with a different kind of issue. They both of them go for job, parents at home. Evening they come back and the parents start complaining of pain in their legs. They're diabetic for maybe about 8 to 10 years. But what the young couple think is that these people are watching the TV from morning until evening, and they're also having good food and they're talking to everyone. Moment we come in the evening, they think of having the attention seeking output or outlook, so that they can always seek the attention of the young couple. Now often it happens like our pain clinic ends up as witnessing these kind of conversations, and where probably the young couple probably express their displeasure, and elderly people say, why should we do all these things to seek somebody's attention? After all, he was my son, he grew in my hand, why should I seek his attention? I brought him up. So then I had to explain to them, many of this diabetic neuropathic pains, they come predominantly in the evenings, not in the morning hours. And that's why when you reach home, you think they say is that they're getting the pain and all. You get distracted because you are slogging since morning, you're tired. And these people also get the pain that time. So that's how it's a cumulative kind of problem. So these kind of counseling sessions, sometimes we do what is called nerve conduction study, where we establish, yes, patient had a valuable reason to show this kind of neuropathic pain. They get convinced. Yes, now many people, elderly people, they cry after my clinic. Okay, doctor, I don't mind dying with this pain, but at least you made sure that my family knew that when you're saying pain in the late evenings or nights and all, I was not lying. So when they start crying, we start finding it very difficult to address, but that's the crux of the problem. In this era where man has conquered air, water, and for that matter I should say the land, and everything. You talk of sky and everything, but one thing we are still not able to conquer is pain. Let's admit that one. Let's admit, so that we will be able to work toward this one. Be more research, or probably more interactive sessions, and probably more knowledge sharing, where we can find some answer. Because if people are going to live for longer time, this pain is going to hurt them significantly. So what we call quality of life, to work in that direction, we need cooperation of the society, the system, the government policies, the healthcare units, and of course, not last but not the least, all the healthcare professionals and the citizens of this country. Thank you very much.